Hello friends, in the first part of vitamin D and nephrotic syndrome, we saw a 10 years old child got alright with vitamin D supplementation and lifestyle modifications, which included mainly clean bowel, sunbath and being only on fruits and vegetables. Then we saw that there is a similarity between vitamin D structure and steroid structure. Then we came to the understanding that there is an antigen antibody reaction and antigen antibody complexes deposited on basement membrane of the kidney filter system. Now we come to the second part of vitamin D and nephrotic syndrome association, and we are trying to prove that vitamin D is low in nephrotic syndrome. So here is a study done in 1977, Lancet. 33 patients had a vitamin D around 7.6 nanograms, while the normal being 70 to 150 nanograms per ml. Goldstein in year 1977 showed in 26 nephrotic syndrome patients vitamin D being just 1 to 18.6 nanograms, while their normal counterparts had 21 nanograms per ml. In 1985, 16 children with active nephrotic syndrome had a vitamin D lower than 20 nanograms per ml. In 1986, same scientists showed in 58 patients that in relapse the vitamin D were as low as 9 nanograms per ml, and in remission they rose to 30 nanograms per ml. In 2009, 12 nephrotic syndromes with normal renal functions had vitamin D of just 4 nanograms per ml, while control was 37 nanograms. Then in 14 centers across the Midwest Pediatric Nephrology Consortium, in 2016, 61 nephrotic syndrome patients aged 2 to 18 years showed a vitamin D level below 20 nanograms. And at follow-up, 27 out of them still had vitamin D below 20 nanograms per ml. In 2020, with 79 cases of nephrotic syndrome, the vitamin D was low and it was related to the degree of proteinuria. These three studies show that vitamin D did not come to normal even in remission. And now we try to study what vitamin D and vitamin D binding protein lost in urine. 1977, the scientists proved that yes, vitamin D is lost in urine, vitamin D binding protein is also lost, and vitamin D was as low as 7.6 nanograms per ml. In 1982, in 26 nephrotic patients, they showed enhanced urinary excretion of vitamin D as well as vitamin D binding protein. And in this study, 10 patients' urine was tested and was positive for vitamin D binding protein, and 3 patients were given radio-labeled cholecalciferol, and it was rapidly excreted in urine. So much so that it reduced the plasma half-life of 25 OHD. Friends, we have to think that there must be other proteins also lost in urine apart from albumin, vitamin D, binding protein, and those proteins which are lost in urine, they must be creating some havoc in pathophysiology which we have to manage during our treatment. When vitamin D is low, lipoprotein lipase activity is low, and so the cholesterol rises. So one thought process is that majority of workers are showing that vitamin D is low in nephrotic syndrome. Some of them further show that there is a decline due to vitamin D lost in urine. But to us, the most important papers are which show that vitamin D will decrease proteinuria in nephrotic syndrome patients. So does it really do? Does vitamin D decrease proteinuria in nephrotic syndrome patients? This study with 26 children with nephrotic syndrome had low vitamin D, and on supplementation of vitamin D, the proteinuria decreased. Vitamin D levels were inversely proportional to proteinuria. That is, lower the vitamin level, higher the proteinuria. And vitamin D levels were directly proportional to serum albumin. Higher vitamin D levels, higher serum albumin. And after supplementation, there was reduction in proteinuria and there was a rise in serum 25-OHD. There's another thought process which shows that is there a relationship between steroid resistance and low vitamin D in nephrotics? Do kids become steroid sensitive after vitamin D supplementation? Does vitamin D have a steroid sparing effect? Can vitamin D alone handle the disease? And there should be different plot for each patient. Yes, friends, vitamin D does have a facilitating action on steroid resistance. That is, you give vitamin D and the steroid resistance will decrease. Now they studied 31,000 children and adults and showed that taking oral steroids is linked to severe vitamin D deficiency. Now we come to vitamin D and calcium needs in nephrotic syndrome patients. See, vitamin D is supposed to be an osteoprotector. So children were given vitamin D supplement and they were found that it has, yes, osteoprotective effect on bones. And different trials needed different doses. Means each child has to be tailor-made treatment for vitamin D and calcium. So there is third thought process which says that till date, majority of scientists thought vitamin D as osteoprotector and supplement it either after steroid course or in recurrent relapses. I view vitamin D as a game changer. It will prevent autoimmune destruction of the glomerulus basement membrane. It will decrease proteinuria. It will handle all the complications of nephrotic syndrome. Example, high blood pressure, psychosis, osteopathy, infections, cancers, and many, many more. I shall use steroids only in dire emergency, and that too a short course. I use vitamin D in place of steroids in nephrotic syndrome. These two studies show that given vitamin D, the blood pressure comes to normal. Anemia, yes, it is corrected. Now there is a meta-analysis of 177 published research papers which show a novel therapeutic benefit of vitamin D receptors in kidney disease. So when vitamin D receptors are activated, there is a protection against renal injury by suppression of autoimmunity, anti-inflammation, restoring mitochondrial function, inhibiting renal fibrogenesis, inhibiting renal cell apoptosis, and suppression of renin-angiotensin system activation. Now let us come to the dose of vitamin D in nephrotic syndromes. 4 patients were given vitamin D of 7,000 to 14,000 international units per day for 1.5 to 3 years. Vitamin D levels still remained below 30 nanograms per ml. And the levels were different for different patients, which means that every patient needs a tailor-made vitamin D dose. So the fourth thought process goes on like this, that we will check vitamin D on monthly basis and we will increase the dose till proteinuria stops, or we can even give STOS dose. Even 14,000 international units of vitamin D per day, the levels did not rise above 30 nanograms, the normal being 70 to 150 nanograms per ml. So the fifth thought process goes like this, that vitamin D is bound to protein, it gets lost in urine. More the proteinuria, lower the vitamin D. Vitamin D gets sequestered in adipose tissue. Steroid treatment increases the amount of adipose tissue, and steroids on their own decrease vitamin D levels in blood. So with all these 5 points, the vitamin D requirement in nephrotic patients is very high. So this study, in 43 patients, they gave 60,000 international units orally per week for 4 weeks. And they found that the levels were high, but the relapse number did not decrease, because this dose, friends, is not sufficient in nephrotic syndrome. As we have already said, nephrotics require very high doses of vitamin D. And now the sixth thought process. As vitamin D is lost in nephrotic syndrome, there is vitamin D deficiency. Now there will be more autoimmune destruction and more vitamin D will be lost, and this again will lead to more autoimmune destructions, means a vicious circle has formed and we really need to get out of it.